Thank you for being so cooperative in the comprehensive oral exam. I did a great job. I would just like to go over some of those results with you. So in the intraoral and extraoral exams, you did where we were checking for abnormal pathologies. Everything came out great. There were no problems there. When I was looking at your teeth, though, I did see that there was a pretty moderate amount of fluorosis, which is basically when you have an overabundance of fluoride in your teeth, and that tends to cause erosion in the enamel, white spot lesions, and increased incidence of caries. So because most of your teeth had this demineralization, I would recommend using an MI paste, which will basically help remineralize your teeth without the use of fluoride, since you're dealing with an overabundance of fluoride in your teeth. And there were also some very shallow carious lesions in your premolars, and that could also be potentially remineralized with the same MI paste, which is just a tube of toothpaste that you would use every single day, just like your normal toothpaste. I saw that you brush multiple times, and so the reason why you have these lesions is most likely not due to oral hygiene, but because of the condition. So we're going to try to work to remineralize as best as we can. Next, I did see that you had a deeper carious lesion on one of your molars. So what we should do with that is definitely remove the caries, remove the cavity, remove the bacteria, and restore that with the material of your choosing. And that should be able to be taken care of pretty simply. And we can do that in your next visit. And then in addition to that, I saw that you had a previous restoration that had a little bit of an overhang, which means that basically it's jutted out a little bit. And so what we typically like to do in that situation is maybe just replace that part of the restoration so that bacteria doesn't get trapped under it. And if you choose to do that, then it would probably be helpful for the prognosis of that tooth. So I think that it would be, you are at a high caries risk because of the fluorosis, and so I think that it would be beneficial for you to come in as soon as possible to fix the deeper caries lesion. And then after that, you should probably come in 3 to 4 month intervals so that we could continue to check on your progress, because you have had a couple of caries in the more recent visits that we've had. So we would definitely like to keep tabs on that and make sure that it doesn't get any worse. And in terms of aesthetics, because of the fluorosis, besides the MI to remineralize, there is also the option for whitening to remove some of the staining that is involved throughout your mouth. And also another option is a kind of a composite blend to help kind of cover up those white lesions and the translucency that comes with the enamel degradation. And those are completely up to you. Those are not a primary concern. I would definitely prefer to get through the remineralization and fixing the carious lesion that you do have before we get to the aesthetic components, but those are definitely an option for you as well if this is something that you have considered before. And if you have any further questions, please don't hesitate to reach out to me. And yeah, thank you so much.